What will it take to attain universal access to sustainable water, sanitation and hygiene services by 2030? It is becoming increasingly clear that water, sanitation and hygiene services are delivered not only through infrastructure, but through an underlying support system that keeps infrastructure productive and efficient. Systems are the networks of people, organizations, institutions and resources required to deliver services. A number of bureaucratic, social, technical and financial factors constantly interact and thus impact on the service delivered.
For you to have that water coming out of a tap in the rightful quantity and quality that you would appreciate as a user, or to have a proper place for your sanitation, all of those cannot come just out of the blue. So that's why we are talking about a systems approach, that you need to ensure the right people have the right rules and regulations that they are following.
Take Kabarole District for example, located in Rwenzori Region, Western Uganda. Kabarole has a population of 475,000 people, of which 114,000 do not have access to safe water. Since 2012, IRC, International Water and Sanitation Center, in partnership with district local government and other actors, has been promoting the systems approach to the delivery of water, sanitation and hygiene services in Kabarole District. Examples abound of successful application of the systems approach, leading to a reliable supply of water.
Kabarole District water supply coverage stands at 81% and sanitation coverage stands at 84%, meaning 19% of our households do not have access to a safe water source within a reasonable walking distance from their homes or institutions. We are grappling with the issue of hand washing with soap. We still have a low coverage of around 21%. Latrine coverage is 84%. Most of the households have basic latrine facilities. We've also observed in the Kabarole District that whereas some homes have latrines, the practice of open defecation still persists. So we are handling both the issue of the structures, the infrastructure, but also the change of the mindsets to have 100% sanitation coverage by 2030.
One of such functional systems is the Chichwamba Gravity Flow Scheme, which exemplifies proper infrastructure development and management. Since management of the scheme was taken over by Midwestern umbrella organizations, clients have enjoyed a reliable supply of water.
In Chichwamba Gravity Flow, we have to make sure that there is constant water flowing. People have to access water at full time, 24/7. We have to make sure that the water at the source flows up to the reservoir tank, from the reservoir tank to the people, so that the people they open and take water at any time they want. We make sure that there is water at the reservoir tanks and the pipes are well connected so that people get water. We have to make sure that there is no leakage which will stop people from accessing water. We control tap stands so that people open and get water.
In spite of numerous challenges, the Gravity Flow Scheme remains functional because of a wide range of interacting factors. These include water users' willingness to pay for water, presence of a professional scheme manager, and enabling policy and regulatory environment which empowers the umbrella organization.
Right now we have 387 private connections and 58 public tap stands. Out of 58 public tap stands, around 28 are working.
The delivery of WASH services is far more complex and demanding than just the development and management of infrastructure. Where there is a weak link in the system, citizens endure poor quality and unreliable services. The weak links in the system manifest in many ways, including absence of specific policy and legislation, inadequate capacity of WASH institutions, lack of long-term planning and budgeting, insufficient sector funding, poor water resource management, unreliable operation and maintenance of facilities.
When we came here to assess the problem of this water source, we found out that it needs around 692,000 Uganda shillings to rehabilitate it, and that budget was sent to the district for consideration. But the community here, they feel that this water source belongs to the primary school, and the primary school also thinks that the borehole belongs to the community. So ownership is not yet clear.
Perhaps the weakest link is the failure to implement and enforce legislation and policies relating to water and sanitation service delivery.
Uganda as a government has good policies in relation to water resources management, and the policies exist. So what has been the challenge, I may not call it mainly weaknesses, but a challenge is that the implementation of these guidelines has not reached a stage where it should be. If you go, for example, it is known that by law, for example, Mpanga River is gazetted to have 100 meters buffer zone on both sides. It is gazetted and it is put in what we call the National Environmental Management Guidelines. But the implementation of that is still a challenge. If you see the activities people are doing upstream, these are the issues that have to be tackled. But with the policies, I think the policies are within and are good policies. The government of Uganda, through the Ministry of Water and Environment, has right policies, but the implementation is still low, and we need all the partners to come up and we make sure that these guidelines are implemented.
To strengthen WASH systems, IRC and other partners have introduced a number of approaches, including the development of a district WASH master plan and the formation of the district WASH task team.
The Ministry of Water and Environment, through the Technical Support Unit 6, together with IRC Uganda, assisted Kabarole to come up with a district investment plan. So we looked at what infrastructure we have now, both functional and non-functional. We looked at the gaps, what are the gaps there in view of some of the people's development needs. And we tried to vision and see that by 2030, how much water do people need and where do they want this water. So we came up with an investment plan that shows you the technologies, it shows you the costs involved, and shows you the service levels that we shall have by 2030.
I think for a long time, we have not had such comprehensive plans that tackles issues of how we are going to do monitoring, of how we are going to coordinate efforts and resources, of how we are going to ensure that water resources, where we are drawing all this water, is well maintained. So that's why for IRC, we have felt that we come up with a comprehensive plan, which we are calling the District WASH Master Plan.
It is important to acknowledge that oftentimes the system may not function perfectly. Many of the buildings blocks overlap. Depending on the time and context, some building blocks may be more important than others. But the core element of system strengthening is that for the services to be delivered, all building blocks must be present and working to at least a minimum level.
I think Kabarole is on course to achieve SDG 6 because we know we have a good network of the partners here working together well. We have a common vision. We all want the people to have good water and sanitation. We're following the same methodologies to implement water and sanitation in the district. We've cut down on redundancies. We do not do duplication. We've allocated geographically the areas for the partners to work with. So going forward, I think that We need to have good leadership at the village level. We need to not only look at SDG 6 in isolation, we need to bring in especially the first 5 SDGs. We need to fight poverty, we need to fight hunger, we need to look at the health. We need to link SDG 3 with SDG 6.